At the end of this lesson, you should be able to identify common discomforts in exercise, its causes, prevention, and treatments. Second is to discover common areas in the body where these exercise discomforts occur. And lastly is to understand that discomforts in exercise are normal and it should not hinder a person from engaging in an exercise activity. For beginners who are just engaging in an exercise routine, here are some common discomforts that you might experience, which we will discuss today. And these are muscle soreness, muscle cramps, side stitches, blisters, chafing, and shin splints. You will discover the different causes of each and where they commonly occur throughout the body. The very goal of this lesson is for you to also discover how to prevent these discomforts from happening and what possible aid or treatment you can do if ever these things occur. At the end of this lesson, prepare for short quiz number 8. This will be used to gauge your overall comprehension of the lesson presented to you today. The quizzes will come in the form of multiple choice or matching type. It will each have a total of 10 points, enabling you to further remember and grasp the concepts discussed in the lesson today. We begin with the most common and very basic form of discomfort everyone experiences during exercise, which is muscle soreness. This type of discomfort is very noticeable, especially when you are new to exercise. But this does not mean that if you are an athlete, you no longer feel sore from a workout. Muscle soreness is described as a discomfort or tenderness after a high-intensity workout. From the activities that you did earlier in the course, did you feel sore afterwards? Say for example, when you performed the squats the first time, did your muscles ache? Muscle soreness is caused by general fatigue brought about by chemical waste products that build up on the exercised muscles. This could happen to any part of your body, but the site at which it may occur is not certain. Muscle soreness is also called delayed onset muscle soreness or DOMS. Ever worked out and you feel more sore a day or 2 days afterwards? Recall that during the previous lesson, your muscles are the biggest sites in your body where chemical reactions occur. Lactic acid is one of those chemicals in the equation. DOMS is caused by this chemical waste product. This may last for 2 to 4 days within your system if you do not follow it through with a stretch or a workout. When lactic acid within the muscles have already settled within the fibers, the soreness you feel in your body will become obvious. See, every time you exercise, your muscles will always have the tendency to feel sore. These are some of the possible reasons for your muscle soreness. When you exercise, your muscles develop microtears. These microtears are microscopic, like the one shown in this picture. When these microtears occur, they eventually heal and cause your muscles to become bulkier and sturdier. Is this normal? Yes, this is very normal, especially when you are engaged in regular exercise. Your muscles go through the cycle of breaking and repairing until such time that they grow and become strong. Another possible cause of muscle soreness is that muscles tend to hold fluids within its fibers. Water retained within the fibers irritate the pain nerve endings of the muscles. When this happens, you actually feel a burning sensation within your body. And the last possible cause of your muscle soreness is when your muscles have been pulled awkwardly or are overstretched. When your muscles go through such tension and stress, especially when they are not well prepared, it may cause larger tears within the muscles, causing it to feel more sore for a longer period of time. This is the reason why warm-ups, cool-downs, and stretches are an important part of training. But we will dwell in this topic later in the module. Muscle soreness or DOMS is very common in individuals who begin an exercise program or participate after a long layoff from exercise. Soreness is really noticeable to people who have just started off with exercise or have gone back from a long period of rest from exercise. You have to understand that this phenomenon is really normal, and it should not hinder you from continuing with your exercise routine. You may also experience DOMS if you exercise beyond your customary intensity and duration. What this means is that you have exerted extra effort during the workout because the load or stressor applied to you has changed. Say for example, you have just begun lifting 10 pounds of dumbbells for 2 weeks, and then the following week, you decided to increase it with 5 pounds. Your body adjusts to this and it will experience soreness. How do you prevent muscle soreness? What must you do to decrease feeling excessively sore after an exercise? The best way to do this is to warm up gradually before an activity and stretch properly after the exercise. Muscle soreness can really be an irritating feeling, especially when you are performing daily tasks like climbing the stairs or sitting down. Here are some possible treatments that you can perform to ease your body from muscle aches. You can try doing a mild stretch for the muscle groups that seem to be aching. Your legs are usually the sites where muscle soreness occurs because they are composed of large muscle groups where series of chemical processes take place. You can also try performing low-intensity exercises before and after an activity. Low intensity meaning with little effort. Exercises like walking, jogging in place, or performing jumping jacks are examples of low-intensity exercises. This can inhibit proper blood flow and muscle relaxation within your body, decreasing your chances of feeling sore after a workout activity. After an activity, low-intensity exercises can help flush out the lactic acid that have built up within the muscle fibers. This is one of the body's natural way of flushing chemicals because it can also use this up as a source of energy. And the last activity you can try is to take a warm bath or use heating modalities like hot packs or hot towels to ease the area of soreness. Your muscles tend to relax when heat is applied on them, and this simple trick could possibly lessen your soreness. You have to know right now that there are no real preventions for soreness. Soreness is a normal response of the body to the increased exertion in exercise intensity. It is a large part of an adaptation process that causes muscles to recover and build properly, therefore eventually improving endurance and strength in the musculoskeletal system and the whole of your body in general. So, do not be disheartened if your body aches after a workout. Clearly, these muscles have exerted effort, and you can be sure that you did your best during an exercise routine. Let's now proceed to the next discomfort in exercise, which are muscle cramps. Unlike muscle soreness, a natural process that occurs in exercise, muscle cramps is described as a sharp, involuntary muscle contraction during activities or at rest. Have you experienced this in your life? You would clearly know when it occurs because the feeling is really painful and you can't seem to move that particular body part. Muscle cramps may occur in different parts of the body, but the usual sites it occurs at is along the muscles of the legs and arms. Muscle cramps can be caused by a lot of factors, and here are some indicators that you can consider if you feel this occurring during your exercise routine. The first and most probable cause of muscle cramps during exercise is brought about by fatigue. When your body is tired, your brain sends signals to your muscles indicating that you have to stop and take a short rest from the activity. Fatigue in the muscles can cause excessive muscle cramps that may last between 30 seconds to minutes, depending on the first aid that you will apply on it. Once you know that you can no longer exert effort, you can always slow down or totally stop performing the activity. Second probable cause of muscle cramps is dehydration and electrolyte imbalance. Excessive dehydration deprives your muscles with the necessary fluids it needs to perform push and pull actions efficiently. Are you a fan of liquids every time you exercise, or you only consume them in small amounts? Do you forget to rehydrate after working out? Dehydration can cause severe muscle cramps, also because of the lack of electrolytes within the muscles. What are electrolytes? These are chemicals essential within the body that provide proper function within each cell. They may come in the form of sodium, potassium, chloride, and bicarbonate, which can be found in several sports or performance drinks, like Gatorade and Powerade. In little amounts, the muscles are not supplied with enough energy it needs for muscle contraction. That is why a sharp and involuntary pain is felt when cramps sets in within the body. Low levels of calcium and potassium within the blood can also cause muscle cramps. This is where nutrition will come in and how it directly affects a well and fit physical body. We will discuss this further in the course. For now, let's proceed to the last probable cause of muscle cramps, which is strength imbalance. What does this mean? Imbalance is normal in the human body because of right or left side dominance. Strength imbalance also has something to do with how you perform exercises. Muscles always come in pairs, meaning one is responsible for pushing while the other is responsible for pulling. The best example of this is in the legs. Remember your hamstrings? Where are they located? Yes, they are located at the back of your thighs. What these muscles do is they pull the body in its right position every time you are in movement. This way, you are prevented from falling over. The pair of the hamstrings is located at the front of your thighs. These muscles are called quadriceps. They assist you in performing pushing or forward movements and prevent your body from leaning forward too much. When these muscles are imbalanced, their endurance and strength is compromised, causing your muscles to feel that sharp and involuntary pain. Upon the onset of muscle cramps, here are the things you need to do for the pain to subside and for you to feel a lot better during the exercise. Of all the available treatments for muscle cramps, fluid intake is the most important. Fluids may come in the form of water, sweet juices, or sports drinks. In whichever form they may come, it will help a lot in balancing the water loss your muscles have experienced during exercise. Once you feel that cramps are about to settle in, it's time for you to take extra fluids to prevent it from happening. Second possible way of treating muscle cramps is to perform a stretch for that particular cramping muscles. The stretch must be gradual and must be held for 30 seconds to 1 minute while you are simultaneously breathing through the stretch. The muscles will gradually lose its tension and you will only stop until muscle cramps have fully subsided. Third possible treatment for muscle cramps is by performing low-intensity exercises before and after an activity. This way, you are preparing the muscles for the heavy activity that you are about to do. A gentle massage to the cramping area will also help reduce the sharp pain along your muscles. Just press and hold and release the muscles so that the tension will eventually release itself. Lastly, if you are experiencing really bad cramps, you must stop the activity. This is to prevent you from further damaging your muscles and possibly save you from injuries and accidents. Muscle cramps are a very serious form of discomfort, especially in cases where water is an element of an exercise. A lot of people drown because of their ignorance on how to manage bad cramps. These things are all the possible things that you can do to ease your way out of muscle cramps. Remember them well, for it will surely help you in case this type of experience arises in your life. We will now proceed to the third body discomforts you experience during exercise, which is known as a side stitch or side stitches. Ever tried running and you had to stop because you felt something painful along your rib line? That is typically what you call a side stitch. It is described as a sharp pain felt just under the ribs. Typically, you will feel the pain on the right side of your abdomen. This is somewhat the same experience you've had with muscle cramps, but this time, the pain is not located along your limbs. Your rib area is the site at which this pain will be clearly felt. Ever had this experience? Did it stop you from performing your exercise routine? Did it hinder you in finishing strong in a race? Side stitches are a common exercise discomfort associated with the sport of running. Here are some of the probable causes of side stitches during activities. First is if you have participated in an activity before your body has had a sufficient warm-up. Warm-up routines are activities performed before the main exercise. It is important in conditioning the body as well as the mind in preparation for the vigorous task ahead. Notice that this has been one of the possible reasons from all previous discomforts discussed. You will discover the importance of a warm-up routine later in the course when we discuss the different phases of exercise. For now, just be aware that almost all discomforts are a result of poor warm-up exercises. Second cause, and probably the number one cause of side stitches, is brought about by improper breathing patterns. Sometimes when people exercise, they tend to hold their breath, especially when the activity is getting too hard to perform. You might be unconscious of it, but these improper breathing patterns create pressure in your abdomen, particularly inside the diaphragm area. As pressure builds up along your abdomen walls, air is pushed through your pain nerve endings, causing the pain you feel along the sides of your stomach. Third and fourth probable causes of side stitches is brought about by your body's lack of conditioning and weak abdominal muscles. When you don't have enough training and you don't focus on strengthening your core muscles, side stitches might end up bugging you through your exercise routine. Through constant practice and proper training, you are preparing your physical body to go through the stress of exercise, preventing you from experiencing this discomfort. A while ago, I've mentioned that improper breathing patterns like holding your breath can cause side stitches. The fifth probable cause of side stitch is a condition called ischemia. Remember this condition from our discussion in Lesson 5? Ischemia does not only occur in the heart but also throughout other parts of the body. Like in this case, ischemia refers to the lack of oxygen to the diaphragm. This is caused by shallow breathing that can eventually lead to side stitches. This is one of the reasons why when beginners are about to start a program, most of their instructors never forget to remind them how to breathe properly. This way, they are preventing the onset of several exercise discomforts which may hamper a person's performance. Sixth probable cause of side stitches is an excessively high-intensity activity. When you are a beginner, you are supposed to exercise at a beginner level. And in the same way, if you are a pro, you will exercise at a pro level. This is often overlooked by a lot of people. They think that they can always take a challenge without any consequences. Excessively high-intensity workouts are only best suited for individuals who are well-conditioned in their craft. You should not rush through anything, as this may cause you injuries and a lot of unwanted discomforts in your body. The last two probable causes of side stitches has something to do with what you put in your body. And these are a heavy meal prior to an exercise and dehydration. About 72 to 79% of your body is made out of water. This component enables a lot of processes within your body to become very functional and balanced. Dehydration can cause severe chemical imbalances, causing side stitches to occur within your abdominals. Also, if you have consumed a heavy meal before a workout routine, you better give your stomach the chance to digest that food that you have taken in. See, when you have eaten, your brain sends signals to your body to send more blood in your stomach and digestive organs to inhibit digestion. When you quickly engage in an activity, as blood is pooling in this area, pressure builds up within your abdominals, causing that sharp and irritating pain along your ribs. All these things are probable causes of side stitches that are linked to one another. You can use them in observing and listening to your body while you are exercising. Here are some possible things you can do to prevent or to aid the onset of side stitches within the body. Do not forget to warm up properly. Prepare your body and condition your mind for the activity that you are about to do. Second is to gradually increase the intensity of your exercise, like the one mentioned earlier. Do not rush into anything. Listen to your body and let it tell you if you need to exert effort or slow down. You can also prevent it by not eating a heavy meal, 1 or 2 hours before an exercise. This way, blood will be equally distributed within your body through the exercise. Other things you can do to treat a side stitch upon its occurrence is to stop the activity and stretch or massage the painful area. Remember the torso stretch we've discussed during the skill-related fitness components? This is the best stretch you can perform to slowly ease the pain away. After a side stitch subsides, you can still continue with your exercise, provided that you should now be conscious with your breathing patterns. Always ensure that you are breathing deeply and your breathing rhythm is consistent. This way, pressure will not build up within the abdominal area. So far, we've covered 3 different discomforts, their causes, sites of occurrence, possible prevention aids, and treatments. Which among the 3 have you personally experienced? Did you know what to do back then? If not, I hope you have at least been guided with the knowledge you've learned and you can use them if any of the 3 discomfort occurs again. We still have 3 different discomforts in exercise, which we will discuss next in this lesson. The 4th kind of discomfort commonly felt during exercise are blisters. This discomfort is described as an accumulation of fluid under the skin due to excess friction. If left untreated, blisters can open and crack, which can be exposed to infection. If blisters become infected, it may cause you to limp and possibly hinder you in performing or continuing your activities. Common areas in which it occurs are at the bottom of your feet, at the sides of your legs and little toes, and at the back of the heels and on your palms. Activities like running for a long period and lifting weights can cause blisters. Blisters are common problems for beginners. This is because the skin has not yet developed calluses that protect the underlayers of the skin. Calluses are thick and hardened layers of the skin that build up over time to protect the body from friction and pressure. When calluses are not present on sites where friction and pressure is applied, the skin starts to accumulate fluid and blisters start to form. How do you treat blisters? Can you possibly prevent it from happening? Obviously, this discomfort can cause you serious pain and it can hamper your performance. The best thing to do is to prevent them by applying a donut pad or a corn pad. These things are available in your local drugstores or in health and beauty stores where you can readily purchase them. Corn pads and donut pads are usually advisable to use for women who are always wearing their heels, as these things can cause blisters on the foot. The corn pads and donut pads protect old calluses from peeling and opening to create other new blisters. Second prevention for blisters is by applying a lubricant on the areas where you think blisters might occur. Lubricants like petroleum jelly prevent friction and pressure on the skin, therefore avoiding your chances of getting blisters while you exercise. Third possible prevention for blisters is by wearing double socks. Sometimes when you work out, your feet sweat, and this causes the skin to accumulate water. When this happens, blisters tend to swell up and eventually burst, causing open blisters. When you wear double socks, you are preventing friction by dissipating the pressure of the stress on your socks. If in case the blisters start to crack and burst open, you simply need to clean it by washing the affected area and applying antiseptics and bandages on the skin. Do not remove the skin while cleaning the wound. Just leave the skin and let it fall off on its natural course, because if you do, you will further damage surrounding areas of the skin. We now go to the next discomfort commonly felt in exercise, which is chafing. Chafing is described as a discomfort in which skin rubs against skin or against any clothing. This eventually becomes irritated, further leading to crack and bleed. Do your thighs rub against each other when you are walking? How about when you're running? Do your clothes seem to rub against your body? Chafing is a burning sensation or feeling on the skin that is caused by continuous friction. Common areas in which it can occur in the body are between the thighs, under the armpits, or even sometimes right on top of the nipples. Chafing is very common for marathoners and other individuals who are engaged in prolonged activities. The longer the time the activity, the more chafing becomes aggravated. Can you avoid chafing? What possible aid can you do to treat this type of discomfort? What's the best way of preventing this from happening? Upon the onset of chafing, the best treatment you can do is to apply petroleum jelly. This is a type of lubricant or ointment that is waxy and soft in nature. When applied on the skin, it lessens the friction during skin or clothing contact. Athletes who are engaged in heavy aerobic activities like marathoners, cyclists, and triathletes usually have this in their first aid kit. This is so that they can continue on with the race even if chafing has occurred. Other ways of preventing this discomfort from happening is by wearing smooth clothing, meaning the materials of your workout clothes should be made of non-abrasive materials or are synthetic at best. This way, your skin glides smoothly as you move about. Aside from this, sweat is not absorbed by this material, making your clothing lightweight throughout your exercise. You should also avoid wearing cotton materials. Not only do they create too much friction when they become soaked in sweat, but they also tend to become very heavy and hard to carry while you are moving. And the last way of preventing chafing from happening is to avoid wearing excessively loose or tight clothing. These materials tend to rub on the skin, causing too much friction, especially when lubricants are not present. Chafing is a very serious exercise discomfort. If left untreated, it will further lead to infections and other skin disease. The irritation brought about by friction, combined with germs or bacteria found in sweat, are factors that can add up to the discomfort's complications. It is always better to have a lubricant or ointment in hand, especially when you know that you are about to engage in activities that are high in intensity and could last for long hours. Finally, we are down to our last exercise discomfort, which are called shin splints. Shin splints refer to pain along or just behind the shin bone. This bone is particularly called as the tibia. This type of discomfort happens over a prolonged period of time, meaning it does not happen as soon as you engage in an exercise activity. Shin splints occur when there is constant pressure applied to the bone. Runners usually have this type of discomfort. This is because as they push off their body off the floor, the cement also recoils the same amount of pressure that their body placed upon it. This pressure becomes very constant, especially when the person has been running for hours. Other causes of shin splints is an inappropriate training intensity and duration. If you are rushing things in your training, chances are you will develop this discomfort. This is because your muscles and bones are not yet ready to absorb the impact of the shock brought about by an activity, thus making you feel easily fatigued and can totally hinder your performance. Other possible causes of shin splints is in performing quick or wrong warm-up and cool-down activities. Like we've been discussing early in the lesson, all training programs are dependent with an appropriate warm-up exercise. This is to prepare the body and the mind for the activity ahead. Another possible cause for shin splints has something to do with your footwear. Do you wear rubber shoes while working out? Or you only wear the available footwear you have, like sneakers or sandals? Your footwear has something to do with your performance as well. There are a lot of shoes available in the market today which would suit your specific running needs. These shoes are built to support your gait patterns and can secure your efficient performance. Here are some possible preventive measures you can take to avoid having shin splints. First is that when a shin splint seems to be occurring already on your leg, you must lessen or totally avoid running on hard surfaces too much. This is to lessen the pressure or the impact your body is experiencing while you are trudging through in a race. Second is that you must ensure to wear the most appropriate footwear for running. It should be enough to cushion the force impacted on the body from the floor. Lastly, never forget to perform proper warm-up and cool-down exercises for your body to be conditioned for the impact you are about to experience. Once you have shin splints, it will always be a present irritating pain that will bug you if you fail to strengthen your leg muscles and build on your endurance. After a race or a short run, once the area is painful, do not forget to apply ice on the painful surface. This is to numb the pain nerve endings that are causing the shin splints. Second, and probably the most important treatment for shin splints is by taking a rest from the activity. This is a direct signal to your body that you are overdoing the exercise. The best way to prevent this from further aggravating is for you to take time off from the activity. Maybe you can take a day's rest and arrange your training routine every other day. This way, you are well rested and you are not pushing yourself too hard. Those are the different exercise discomforts. Which one of these things have you personally experienced? Did you perform the appropriate first aid for the discomfort? Are you now more aware of the proper prevention in case these things happen to you? All these things are direct signals to your body that something is wrong, and you either need to slow down or totally stop what you are doing. Remember the phrase, no pain, no gain from the previous lesson? This is not true, and you should not view exercise as this. Whenever there is pain, always pause, reassess, treat. You should not dismiss any discomfort your body is experiencing, because they may further lead to injuries that are irreversible. As a result, your efficiency will be compromised, or worse, you will no longer be able to perform the activities for a long period of time. Now you know the different discomforts in exercise, their causes, preventions, and possible treatments. I want you to remember all these last phrases before you go. Listen to your body. Know when enough is enough. You won't be able to push through with any activity if something in your body is hurting. You'd surely end up frustrated because of your incapacity to perform the work you are supposed to do. Also, you have to know when you have to put more effort, because if you are not exerting the right effort during your program, the whole thing will become very useless. Another thing you need to remember is that you have to rest as much as you can. Oftentimes, this component is overlooked by many because people think that rest is just for the weak. But this is not true. Rest is as equally important as the training program itself. It allows your body the enough time to recover and reset all the chemical processes that are occurring within it. Having enough rest is a sure way of ensuring a program that will help you in pursuing an effective level of wellness and fitness for a longer period of time. Lastly, when you are a beginner in exercise, you must always know your limitations. Know when you can and cannot perform the activity and be honest to yourself. Because if you are not, you will end up hurting your body, or you might get frustrated because the results you want are not showing up. Remember these things and let them serve as your guidelines while you are on your fitness journey. This way, you can be safe and very efficient going through your exercise routines.